Lori. My name's Danielle. I'm going to be your nurse today, and I just want to go over some teaching with you about how to take care of your feet since you are diabetic. There's some certain things we need to go over and make sure that you have an understanding on, okay?
Okay.
Okay. So, first thing is I want to just go over some general information with you. So, you never want to go barefoot, even in your own house, outside, inside. Make sure you wear slippers when you leave the bed at night. Do not use commercial corn medicines or pads, chemicals such as boric acid, iodine, or hydrogen peroxide, or over-the-counter cortisone meds on the feet. Do not put heating pads, hot water bottles, or ice packs on the feet. If the feet become cold at night, wear socks or use extra blankets. And I see you have your socks on now, so that's good. So the reason you don't want to use heating pads or anything super cold is because the sensation in your feet is lacking, so you don't want to burn your feet or anything like that. Do not allow the feet to become sunburned, so when you're outside, just make sure that you're wearing closed-toed shoes, no flip-flops or anything like that. Do not put tape on your feet, and do not sit with your legs crossed at the knees or the ankles because you want to make sure that you have adequate blood flow to your feet. So another thing you want to do is inspect your feet daily. So you want to check the feet, including in between the toes, daily for red areas, cuts, blisters, corns, calluses, or cracks in the skin. Check the skin of the feet for dry or damp areas. Use a mirror to check each sole and the back of each heel. If you're unable to inspect your feet daily, be sure someone else does so. Do you think you'll be able to inspect your feet daily?
Yes,
Okay.
yeah.
So now I want to talk to you about trimming your toenails, taking care of your toenails. You want to cut the toenails after washing when they're softer and easier to trim. Cut the nails straight across with a clipper and smooth edges and corners with an emery board. Do not use razor blades to trim toenails or calluses. You don't want to have any injuries on your feet with that. If you are unable to see well or reach the feet easy, have someone else trim the nails. If the nails are very thick or ingrown, if the toes overlap, or if circulation is poor, get professional care from a podiatrist. So have you cut your toenails before?
Yeah.
Okay. So now I want to talk to you about buying and wearing shoes and stockings. When you're buying shoes, you want to make sure you allow a 1/2 to 3/4 of an inch of room for toes to spread out and wiggle. The lining and inside of the stitching should be smooth and the insole soft with a good arch support. The sole should be flexible and cushion the foot. The heel should fit snugly. Do not wear open-toed shoes, sandals, high heels, or flip-flops because they increase the risk of trauma. Buy shoes late in the afternoon when the feet are at their largest. Always buy shoes that feel comfortable and do not need to be broken in. Shoes made of natural fibers such as leather or canvas allow perspiration to escape. And some other things about buying and wearing shoes. You want to check the shoes for each wearing for foreign objects, wrinkled insoles, and cracks that might cause lesions. Stockings made of wool or cotton allow perspiration to dry. Do not wear garters, knee stockings, or pantyhose. They may interfere with circulation. Wear insulated boots in the winter. So you feel comfortable knowing all that about buying shoes? You think you'll be able to? Okay. Okay, so I want to talk to you now a little bit about your foot wound management. Say you did have a wound on your foot, how to care for that. So cleansing of the wound bed at each dressing change. Frequent and appropriate debridement of callus, fibrin, slough, and eschar. Maintain proper moisture balance by choosing appropriate dressings to avoid maceration but maintaining a moist wound bed. Wound edges should be opened to enable cell migration across the wound bed. Offloading the wound to reduce pressure through the use of proper shoes or orthotics. So make sure you keep your wound moist and clean and dry. You do get one. and make sure you change the dressing on it daily.
Okay.
So a little bit about skincare for your feet. Never go barefoot indoors and outdoors. Wear warm padded cotton socks in the winter. Will protect the skin from cold and wet weather. Socks should not be so large that they bunch up at the shoe. Socks should also be changed at least once during the day to prevent the moisture from perspiration irritating the skin. Tape or adhesive products such as corn plasters should not be applied to the feet. These may cause fragile skin to peel away. Another thing is when you're applying lotion, you can apply lotion to the foot, but just make sure you're not getting it in between your toes.
Oh, okay.
You don't want to have buildup or anything. You just want to make sure that you're getting the outside of your foot with the lotion, not in between the toes.
Okay.
So some tips for foot care is wash the feet daily with water at room temperature with careful drying, especially between the toes. Make sure it's very dry between there. You don't want any moisture. You use room temperature because you don't want to burn your feet or have the water too cold on your feet. Use lubricating oils or creams for dry skin, but not in between the toes. Do not remove corns and calluses using a chemical agent or plaster. They should not be excised at home and must be managed by trained staff. Notify the healthcare provider at once if a blister, cut, scratch, or sore develops. Ideally, footwear for people with diabetes should have wide toe box, soft cushioned soles, extra depth to accommodate orthosis if required, and laces or Velcro for fitting and adjustments. Okay, so just some more education here about foot care. So self-exams, it's important to examine your feet every day because you may step on something and not know it, and you may, have an injury that you don't even know about. So make sure you just inspect your feet for any blisters or anything like that. This should include looking carefully at all parts of your feet, especially the area between the toes. Look for broken skin, ulcers, blisters, areas of increased warmth or redness, or changes in callus formation. Let your healthcare provider know if you notice any of these changes or have any concerns. It's very important to manage your blood sugar. So in general, you can reduce your risk of all diabetes-related complications by keeping your blood sugar levels as close to the target as possible. Do you smoke?
No.
Okay. Because smoking can worsen heart and vascular problems and reduce circulation to the feet. Avoid activities that can injure the feet. These include walking barefoot, since you could step on something without realizing it, using a heating pad or hot water bottle on your feet, and stepping in a hot bath before testing the temperature. Wash and check your feet daily. Use lukewarm water, mild soap to clean your feet thoroughly. Dry your feet, paying special attention to the spaces between your toes by gently patting them with a clean, absorbent towel. Apply a moisturizing cream or lotion. Be sure to get regular foot exams. Checking for foot-related complications should be a routine part of your medical visits. However, this is sometimes overlooked. Don't hesitate to ask your provider for a foot check at least once a year and more frequently if you notice any changes. So you're probably wondering, why do I need to pay attention to my feet with diabetes? And so the reason is diabetes can damage nerves in your feet, so you may not feel pain, heat, or cold. If you get a sore, blister, or cut on your foot, you might not notice it until it becomes infected. If not treated, an infection can get so bad that the toes or foot may have to be amputated. Diabetes also slows down the blood flow to your feet, preventing a sore or infection from healing properly. So how to prevent these problems: wiggle your toes and move your feet up and down for 5 minutes, 2 to 3 times per day to improve blood flow to the feet and legs. Don't cross your legs for long periods of time because this reduces blood flow to your feet. Call the healthcare provider right away if you see any cuts, blisters, or break in skin, or any other changes that don't go away in 24 hours. Ask your healthcare provider if you need special shoes to protect your feet. Cost is usually covered by Medicare and other insurance. Follow a healthy diet to keep your weight and blood sugar level in check, which will help prevent nerve damage and help healing. So you think you understand a little bit better now on how to take care of your feet. Do you have any questions for me about anything?
No, not really. You explained it good.
Okay. So can you just tell me maybe some main key points that you learned from this?
Not to use a hot water bottle or cold on your feet, cold bottle or that. Never go barefoot inside the house, outside the house. Wear socks. Try to keep your blood sugar good, to prevent any kind of sores or anything happening on your feet.
Okay.
So,
Good. All right. I'm glad you understand. And so I'm going to give you some information here that we've talked about today, so you can take this home with you, and that way you'll have all the information there that you need.
All right. Thank you very much.